Hi Mackenzie, my name is Joshua Geiger. I'm a student, family nurse practitioner from Saginaw Valley. How are you this morning?
Good, how are you?
Pretty good. How are you feeling? Do you have any headaches, anything like that?
Not really.
Do you feel anxious at all?
No.
All right. Have you had any changes in mood lately, anything like that?
Mm-mm.
All right, a couple quick questions for you. Do you know where you are right now?
Saginaw.
All right, do you know what year it is?
21.
Yes, and do you know who you are?
Yes.
All right, patient is alert and oriented ×3 to person, place, and time. And then just kind of looking at her right now, she said that she wasn't feeling anxious. Looking at her posture and her behavior, she looks rather calm sitting in the seat right here. Facial expressions, she's smiling, face seems to move symmetrically and everything. I'm not seeing any tics, gesticulations, twitches, anything that looks abnormal. And then her manner, kind of her affect, her general expression, she seems to be at ease. I'm not noting any anxiousness, any anger, anything of that nature. All right, and then I'm going to ask you a few questions here. Can you count from 100 to 50 for me? And count by sevens backwards, so like 100, 93, so on and so forth.
193, panicking.
That's okay, no need to be nervous.
Why is this so hard?
All right, that's okay. Well, generally she would be able to, but it's a little pressure because of the video. So now I'm going to have you draw a circle, and I'm going to have you draw 9 o'clock out for me on the circle. All right, patient is able to draw out 9 o'clock. As you can see there, a little bit reversed. All right, and then I'm going to ask you a couple questions. Can you tell me what 4 times 4 is?
16.
All right, 5 times 5?
25.
And 9 times 9?
81.
Okay, so just kind of in our conversation so far, the basic questions, she's good kind of multiplication ability, kind of abstract thinking. She's able to draw this 9 o'clock on the circle, kind of abstract thinking in a way. And then in just the short amount of time I've seen her so far, it doesn't appear as if she's having any delusions, hallucinations. It doesn't appear as if she's having a distorted sense of reality. Nothing from the mental status exam at this point in time that would lead me to be concerned at the moment. So what I'm going to do right now, I'm going to start with my cranial nerve assessment, but I'm also going to name you 3 words. And at some point later in my assessment, I'm going to ask you to repeat those words back to me. Okay? Apple, pear, banana. So just kind of internalize those in the back of your head. And I guess before cranial nerves too, I will assess kind of long-term, short-term memory. You don't have to be super specific, but how was the weather yesterday?
Hot.
Okay.
Sunny.
Okay, and what's your birth date?
10/3/95.
Okay, so both short, long-term memory appear to be intact. The patient was readily able to pull that information to divulge it to me. Okay, so now we're going to do the first olfactory nerve, cranial nerve 1. I'm going to first have you occlude each nair and breathe through it just to make sure they're both patent. Okay, now I'm going to have you close your eyes, and then I'm going to have you tell me what this scent is.
Lavender.
Correct. And keep your eyes closed. We're going to do one more.
Cinnamon.
Ginger, cinnamon, close enough. Kind of hard to smell out of the container, I suppose. Okay, now I'm going to start assessing your visual acuity, your oculomotor nerve number 2. So I do have my Rosenbaum chart right here. Do you wear corrective lenses?
I do.
Or you have them in right now by chance?
I do.
Okay, perfect. So I'm going to hold this about, or I'll hold this for you about 14 inches away or so, or a couple feet away. I'm going to have you close your left eye, cover your left eye, and then read as far down as you can read on this for me.
ECTPNL.
Okay. Okay, so right eye will be a 20/20. Now opposite eye.
ECTPNL.
A 20/20 in the left eye as well. Now both eyes simultaneously.
ECTPNL.
Okay, so in all senses of the test there, the patient does have 20/20 vision. What color is this line?
Green.
And what color is that line?
Red.
And the patient is able to differentiate colors amongst the lines as well. I'm going to further assess her visual fields. I'm going to have you look straight at me, and I'm going to have my hands kind of on the side of your head, lateral, just behind your ears. I'm going to bring them forward one at a time. And when you can see my fingers wiggling, I want you to let me know. And we're going to test this laterally, upper and lower fields.
No.
Okay?
No. 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 No.
Okay, everything appears to be intact there. Both my hands stopped kind of essentially about the same location. So then what I'm going to do now is I'm going to use my otoscope and assess your eye just a little bit further. Going to visualize the arteries, the vessels, see if there's any papilledema, if there's any patches, any hemorrhaging, anything that looks abnormal. And then I will observe the red reflex as well. See a red reflex. I'm going to get real close to you here. I'm going to put my hand on you. That way I don't have a baby in the head. Okay. Right eye, I'm able to visualize the arteries and the nerves. Kind of the fovea as well, the central area. No patches, anything abnormal in that eye, so I'll do your left eye real quick. I do have a red reflex. I'm going to place my hand on you once again. Okay. And in that eye as well, I am able to visualize the vein and the artery and the central location as well. No papilledema, nothing abnormal. Did that bother your eyes at all with the light going in them like that? Tolerable? Okay. So then what I'm going to do now is I'm going to pull out my pen light here, and I'm going to kind of just assess direct reaction and consensual reaction of your pupils. So I'm going to shine my light as dark in here as I can. I shine my light into your left eye and observe for the reaction in the right. All right. Right eye reacts briskly. Now I will do the opposite. Left eye reacts briskly. Now I will do direct. Right eye is brisk once again. And left eye is brisk as well. Currently, I'd say pupils are approximately 5 millimeter bilaterally. Okay, and now we're going to test your accommodation as well. I'm going to have you stare at this pen light. Now look at the TV behind me. And then pupils are accommodating appropriately for that as well. So now we're going to kind of test your cardinal fields of gaze. I'm going to have you stare straight ahead of me, don't move your head, and then I'm going to have you follow the tip of this pen light, okay? Essentially just making a giant H here. Okay, patient is able to track all 6 cardinal fields. I wasn't noting any nystagmus or any lag in her ability to follow my pen light. Okay, so now what we're going to do is I'm going to have you clench your jaw. Okay, and while you're clenching your jaw, I'm just going to kind of palpate. Okay, so that would begin the assessment of our trigeminal nerve number 5. But kind of backtracking, assessing our cardinal fields of gaze. We're looking at our cranial nerve, oculomotor 3, our trochlear number 4, and then our abducens number 6. Okay, so patient was able to clench her jaw. So what I'm going to do now is I have kind of a little cotton pad here, And the cotton pad, I'm just going to kind of gently touch in a couple of sections to test the sensory portion of cranial nerve 5. Close your eyes. And if you feel anything, let me know.
Yep.
Okay, so the sensory portion of cranial nerve 5 appears to be intact as well. So then what I'm going to do is we're going to move on to cranial nerve number 7, our facial nerve. So I'm going to have you make a bunch of faces to me. I'm going to have you smile, puff out your cheeks, raise your eyebrows. Okay, everything is moving symmetrically there. She's able to follow those commands. I would say cranial nerve 7, our facial nerve, is intact. So now what I'm going to do is move to our vestibulocochlear, cranial nerve number 8. I'm going to kind of come behind you here real quick, and I'm going to occlude one of your ears. I'm going to kind of do it a couple times, and I'm actually going to occlude it. I'm going to say a number, and I want you to tell me what it is. I'm going to whisper it, I should say.
23.
Okay, now we'll do the opposite here.
41.
41, okay. So our vestibulocochlear cranial nerve number 8 is intact based off the patient's responses. Now what we're going to do is I'm going to test cranial nerves number 9 and 10, our glossopharyngeal and our vagal nerve. I'll have you say ah.
Ah.
Stick your tongue out. Okay. And then patient's soft palate does rise, uveal rises. And then based on our conversation that we've been having this entire time, both of those nerves appear to be intact as well. It doesn't appear to be any aphasia, anything of that nature. Patient doesn't appear to have any difficulty swallowing, controlling secretions. So now what we're going to do is we're going to move to cranial nerve number 11, our spinal accessory. So I'm going to kind of come behind you again, once again for that. I'm going to place my hands on your shoulders, apply gentle pressure, and I want you to shrug your shoulders. Okay, now I'm going to put gentle pressure kind of on the left here, turn your head to the left. Okay, now the right. Okay, and the patient does not appear to have any difficulty in doing that. Each side appears symmetrical in strength. So then what we're going to do is I'm going to have you stick your tongue out, go side to side with it, up, down. Okay, there don't appear to be any abnormal fasciculations. Patient is able to move tongue in all directions without difficulty. Does not appear to be any limitation in that aspect. So what we're going to do now is I'm going to kind of test some cerebral function. So we're going to test your upper extremities. I'm going to have you put your hands like this on your thighs, and then you're going to rapidly alternate them. As fast as you can. Okay, that looks good. And then now we're going to do a little bit further. I'm going to have you touch your nose, touch my pen light, touch your nose, touch your pen light, my pen light, touch your nose, and touch my pen light. Okay, so now what I'm going to do is we're going to kind of go down to our feet, our lower extremities, and we're going to do the same thing. So I'm going to try get a better camera angle here. And I'm going to put, or essentially what I'm going to do is I'm going to have you kind of rapidly alternate the movement on your feet. Okay, and then we're going to kind of test for limb ataxia here. I'm going to have you place your heel on your shin, at the top of your shin, kind of just below your kneecap, and slide it down to your ankle and back up. Okay, now we're going to go opposite with the opposite leg. Okay, and then the patient appears to be doing that without any difficulty, so I will return our camera to a more suitable position. Now, the best angle I can get here, what we're going to do is I'm going to test the patient's gait. And I would make sure that she has appropriate footing on. You know, we want to be cognizant of falls, want her to be as safe as possible. So what I'm going to have you do, Mackenzie, I'll have you kind of walk heel to toe over to this table or this chair right here, okay? And then I'll be with the patient just for safety if she were to fall. or not fall, but lose balance. Okay, now I'm going to have you turn around and come back, walking on your tippy toes. Okay, now turn around and walk back on the heels of your feet. Perfect. Now I'll have you return to this position. You can just walk normally. Stand right here. And I'm going to have you do a slight bend at the knee with each leg, one at a time. Now the opposite. Okay. Now the Romberg, I'm going to have you close your eyes and put your arms out at your side, and then I'll be here to provide support if the patient starts to sway. Okay, it's a negative Romberg. Now I'm going to test your pronator drift. I'm going to have you put your hands about palm up like that, just a little above your shoulders, and close your eyes. And after 30 seconds, I'm just going to kind of push down on them real quick, okay? Okay, that is good. Just for the sake of time for the video, I did not wait 30 seconds for that. You can have a seat for right now if you would like. Thank you for doing those tests. So the whole time during this, once again, I kind of mentioned it during the mental examination, I'm observing the patient's body movement, her body posture, and once again, I haven't noticed any abnormal fasciculations, any tremors, or any twitching, anything that should not be there. Patient appears to have been performing all of the requested tests acceptably. So then we're going to kind of move to looking at our muscle tone. So I'm going to look at kind of the shoulders, the hands, and then the thighs, kind of our major, larger muscle groups. Just kind of palpate gently. Going to take a look at your hands, please. Okay, and then thighs. And then kind of continuing off that, I'm going to do each arm. We're going to kind of test the muscle tone in our shoulder, our wrist, kind of just in one big motion for the whole arm, essentially. So I'm going to grab your hand here, and I'm going to do this. All right, kind of testing the flexibility, shoulder muscle, the mobility of the wrist, everything moves freely there. Okay, and the same moves with the left, everything moves freely as well. So now we're going to just try to position a little better. If you kind of want to lay back a little bit, then we'll do the same test, similar test essentially on your legs. Okay. All right. Okay, you can sit back up. Okay, so now we're going to test a little bit of strength right here. We're going to test flexion and extension. I'm going to put my hands on your forearms right here, and I want you to try pull them back towards you. All right. I'll push away. Okay. Now wrist. So I'm going to have you kind of try to pull up, and then push away. Okay. Bilaterally. Cross my fingers a little bit. I'll have you squeeze my fingers. Not as hard as you can, but good squeeze. All right, your strength is equal bilaterally. So now I'm going to have you do this with your hand. Essentially open it up, and I'm going to give it a squeeze, and I want you to resist that squeeze, okay? You can rotate over. Okay. Okay. So now I'm going to have you try to take your thumb and touch your pinky finger, and I'm going to kind of slip one of my thumb under here and provide resistance, okay? Perfect. The patient does have good strength for all of those tests as well. Okay, so moving on from that now, we've done our finger abduction, we've done our grip strength. So now we're going to go back down to kind of assessing more of our lower extremities. I'm going to apply pressure to your thighs here. I'm going to have you try to pick them up. Now I'm going to put a pressure underneath. I'm going to have you press down best you can on this couch. Okay. Now I'm going to put some pressure on your shin here. Good camera angle. And I'm gonna press, and I want you to provide resistance out. Now I want you to pull back in. All right, now we're gonna test your abduction. I'm gonna put some pressure on the outside of your knees, and I want you to try press out. Now on the inside. Perfect. I'll keep the camera angle here. One more down here, we're gonna test dorsiflexion, plantar flexion on your feet. All right, thank you for the camera angle. Okay, I'm gonna press down, and I want you to pull your feet up towards your nose. Not pretend you're pressing on the gas pedal. Perfect. Both those tests are good. You have good grip strength and not grip strength, but muscle tone and all of those, I should say. Okay, now what I'm going to have you do is I'm going to have you close your eyes, and I'm going to kind of just lightly touch a couple different areas of your body, essentially shoulders, the inner outer aspects of the forearms, thighs, kind of testing for our sensation to touch there.
Right forearm. Left forearm.
The inner or the outer aspect?
Outer. Right shoulder. Right forearm.
Inner or outer aspect?
Outer. Left thigh. Right thigh.
Okay. And did any of those sensations feel diminished or weaker on one side versus the other?
No.
Okay, that's good. Okay, so we've kind of tested your pain, kind of working the way down, kind of superficially, or not superficially, but going distally, I should say. And then important too, during the testing, I would vary kind of the strength, the pressure of the touch that I'm providing, just so that way the patient can kind of expect what I'm going to be doing next, really kind of mix up our results, makes them a little more validated. Okay, so now what I'm going to do is I'm going to get out my reflex hammer right here, and then I'm going to test your brachial, your brachioradialis, and then we're going to do your patellar reflexes. There's a brachial, triceps, and patellar. So I'll place my hand across the brachial tendon like this. Perfect. Okay. And now for our tricep. Okay. You scoot back a little bit, and we will try the patellar reflex as best we can with the couch and the floor kind of fighting us here. Okay. Reflexes all appear to be intact. Wasn't noting any clonus or anything of that nature. So really that concludes the main portion of our neuro exam. The patient didn't exhibit any abnormal responses that would exhibit further testing in our sense right here. Are there any questions on anything, Mackenzie?
No.
All right, well, thank you for your time this morning.